Hi and welcome. Christa, thank you so much for joining me.
Hi, it's good to see you. And hello, everybody out there in internet land. I have my coffee, so we're good today. I always
Awesome.
find
Hi guys, it's so good to be live with you all.
I find it's really
Do we
difficult
have a
with the
delay
touching.
between us, Christa?
Say again?
I think we do.
Okay, there
I
you
think
are.
we might have a delay between us now when we hit the live button.
No, I think you're good.
Okay, okay, good. All right. So guys, welcome. If you're joining us live, it is so good to have you with us. Christa, it's great to have you with us again. This is becoming a little bit of an annual tradition, which is really exciting. So we are going to be talking about lymphatics, lymphatic issues, lymphedema, and we're going to touch a little bit on horses and dogs and the challenges that we could have in both of those, which I think is really great. So if you guys are joining us live, please feel free to ask questions, join the conversation, share any insights or thoughts that you have. It'll be really great to have you. So Christa, please introduce yourself and tell us a little bit about your interest in lymphatics.
Well, I just want to say thanks for having me back again. I think this is year 3. I think last year I was in sunny Florida. This year I am not. I'm in Canada, and we're having second winter, or sprinter, as we like to call it. And so, for those of you that don't know me, I'm actually an equine rehabilitation specialist, and I've been doing this for over 25 years. I think this is my 25th year, and historically, I've been just fascinated with the lymphatic system, and it's actually incorporated into my logo, the lymph nodes and the lymphatic vessels. And it just is something that I've been studying since, I guess, probably 2001 specifically. And I have my advanced manual lymphatic drainage therapy certificate. And so the more I learn, the more I read, the more I study, the more treatments that I have done, it becomes still a big passion of mine. And so March is Lymphedema Awareness Month, and we always like to do a ton of promotion for that and just increasing awareness. There are some more practitioners coming out and specifically treating lymphedema cases and stuff like that. So that's primarily where my heart lies. Now, the other aspect of life, how it takes you places, is that I actually developed a kinesiology tape specifically for lymphedema clients. So that has helped my practice a lot, and that's called Hesteban Lymph.
Which is a phenomenal product, and was definitely necessary in the equine industry. So thank you, Christa, for doing that, for blazing the way for us. Okay, so guys, if you're joining us live, it is so great to have you. Please feel free to ask any questions and join the conversation with us. We're talking about lymphatics in both horses and dogs, which is a huge subject that we're turning into an annual tradition as we celebrate Lymphedema Awareness Month. This is our little bit that we do to help bring awareness to that. Okay, so what are some of the different kinds of lymphatic draining issues that horses deal with and that dogs deal with? What are the differences as well?
There are, there's sometimes when you go out to the stable in the morning and you're like, oh my gosh, his hind legs are stocked up. That can be classified as a very local edema. So it might be just a little bit of swelling. There's not a lot of lymph nodes in the legs themselves. They're more higher up. In actual fact, the horse has about 8,000 lymph nodes, and the majority of them are nestled in near the colon. And so when the horse is in their stall for, overnight or something like that, they don't have that pumping action that is created by movement. And so you can have that sort of edema where, you take them out of the stall, they get turned out, or you hand walk them, you ride them, and the swelling goes away. Generally, we don't worry too much about that sort of thing, as long as it dissipates, as long as the swelling goes down. So that's kind of a local edema. Like if you had a horse that got kicked or, rolled on a snowball, it's just really quite common. And here in Canada, you will have a sizable amount of edema or swelling on one area of their body, and that would be also considered a local site. Regional would be more if you had an entire hind leg that was swollen. And that can happen if there was a severe injury where the lymphatic vessels got damaged or crushed a little bit, or if they're fighting an infection. So that's more of a regional. If you come out and one whole front leg is swollen, that again is a regional issue. Sometimes if they have a reaction to a vaccine, they can have a one side of their neck that would be swollen, and that again would be regional. Now, a systemic edema always warrants veterinary attention. Systemic edema can happen where it looks like the horse has been cut in half, and so that the entire horse on the bottom is swollen. So maybe they had vaccinations yesterday. You come into the stall in the morning and they are completely swollen, all four legs. And so that that there's something systemic going on, that they are really not able to cope with the immune response. It can also happen that if they've been sick for a long time, or if they've had multiple issues, say, for example, if they had vaccines and then a couple weeks later they developed pneumonia, or they ended up having some sort of issue with their kidneys, a kidney infection or whatever, that also goes into the terminology of a systemic lymphedema problem. And always you want to make sure that you have your vet called ASAP on systemic edema cases.
Okay, so we're looking at a local or a regional or a systemic presentation of lymph issues. So in horses, we have a very common, or maybe it's not so common, but what we're familiar with, like a lymphangitis. What happens there? And that's Hi, Meg. It's good to have you. Those are usually very difficult to treat, very difficult to come out of. What is happening there? Why is it such a challenging presentation, and what can we do?
So the biggest thing with any sort of lymphangitis, lymphedema, we have to get the vet on board, because what can happen is that you may have a little area of swelling, say, for example, on a fetlock, and then you try to treat it, but you didn't call the vet in. It may be something deeper within the horse that is brewing. It may be the start of an infection that we didn't, it's not quite, broken into some, huge cellulitis issue, but it's gonna be, on its way. And so as a lymphatic drainage therapist, we definitely do not want to move any fluid that suddenly occurs, and especially if it's hot, if it's very, very swollen, you want to make sure you call the vet in. But if the vet is called and he's like, yep, it's okay, he just needs an anti-inflammatory, then you talk to your vet about what can you do once the medication's finished, if they are on antibiotics, anything like that. And so then you want to make sure, my poor cat's crying. I don't know if you can hear her, but so then after the horse finishes the medication, you can definitely start doing your kinesiology taping, some light massage techniques, things like that. Am I talking really fast? I feel like I'm like very excited today.
It's a good milestone. We usually manage to talk at the beginning of March, right? So that we have like the whole month of March to sit on the recording and to chat about lymph issues. And this month we were a little bit late, guys. I'm sorry. Bad planning on my part, I think. But we're here. It's really great. Alicia, yes, it is being recorded and it will be available to watch after when we're done. And I will reshare all of our previous recordings as well, so that you guys can have a look at that, because we've definitely chatted about some interesting stuff. Hi, Jessie. Guys, it's great to have you live with us. Thank you for joining. Please feel free to ask any questions, join the conversation. We're here to chat together, learn together. Yeah, really excited. So what about dogs? How do dogs present? What are some of the issues with their lymphatic system that we might see? And how do we work with that?
So one of the things that I don't really promote at all is that I used to have a huge canine practice. So I worked with a veterinary clinic and, treated about 25, 30 dogs a week. And it's not that I still don't want to because I love that work. But you can only do so much, right? But yeah, I love working on dogs. And so I think historically, the lymphatic system is the least studied
Mm,
system in the body. I think that's definitely changing. We just discovered the lymphatics of the GI system. And so with dogs, you don't see a lot of, I've never seen a lot of cases, but the cases that I've seen were almost all systemic. Um, you will get some lymphedema cases, like after TPLO surgeries,
mm,
anything like that. Sometimes after spaying. Let's just backtrack a little bit. When you have an injury or surgery that crushes or cuts the lymphatic vessels, obviously that flow is going to change. That pathway is going to be altered. And then with with a lymphedema, everything gets really, really backed up.
mm,
Throw in surgery and then scar tissue development and lymphatic fluid. As I've always said, lymphatic fluid cannot pass through scar tissue or tight fascia. So that's
mm,
something you would see in a dog after a surgery. So it is common that not it's relatively uncommon that you'll have lymphedema in, like, say, for example, a hind leg due to that surgery,
mm,
but it is possible. The ones that I have seen are all systemic, that they have had numerous problems. And really, it is the body's way of saying, the hip bone's connected to the knee bone sort of thing. Because one thing we don't ever talk about is the organs of the lymphatic system. And how the heart and the lung and the kidneys are all connected. And when you have, say, for example, a pneumonia in a
mm,
dog, or if you had, maybe the dog also now has lung issues, that it has kidney issues. um,
mm,
Almost all of the cases I have seen were vet referrals. And if they weren't vet referrals, I got them to get the vet to contact me directly, because I need to know what medication the dogs have been on. But these are
mm,
very, very serious cases where,
mm,
lymphatic drainage becomes the the last resort, because the medications aren't working as effectively anymore, that the lymphatic system is so compromised um, and congested that nothing is really, it's a last resort, hey, let's try it kind of thing. um,
mm,
and so if you very gently start encouraging lymphatic drainage through the body, and you have to really backtrack on your technique, and then it starts to help a lot.
mm,
Several cases that I've treated, we thought that there was no hope, and the vet was like, just try it. We've got nothing
mm,
to lose, and everybody understands that if you do lymphatic drainage too fast, you could overload their system. You don't want to do that technique so fast that you cause, a heart attack in the dog.
mm,
But so it's very severe, and it's working one-on-one with the primary caregiver. The other type of edema that I've seen in dogs is bilateral front limb. And again, it goes back to either some sort of heart congestion, maybe the heart's not pumping as well, but usually it's some sort of systemic edema that I see in dogs.
okay. So you mentioned the organs of the lymphatic system. Do you want to talk us just through the basic anatomy of the lymphatic system?
Um, it's very much like a distinct pathway.
Mm,
The body wants to send fluid down one pathway, you know, gets recirculated through the body and either gets urinated out through the kidneys, or the fluid gets pumped back through the heart and through the body again. And so anytime that you have a problem with one of those organs, there's always a chance that the body can't filter all that fluid properly. And so, we want to say that I don't want to get too complicated. That's too long of a conversation. But if we know the lymph nodes are like little kidneys, okay? So the lymph node itself filters all the fluid through the body, right? It has to. But there's a pathway into that lymph node and there's a pathway out. If for whatever reason the body can't, if you've had severe trauma and there's a large amount of swelling, sometimes what can happen is that these lymph nodes become fibrosed. So they're not real, maybe they should be working at 85, 90% filtration rate. They maybe are so fibrosed and there's scarring in there, so they only work 10%. What we can hope to do is maybe we can't send fluid through that primary lymph node, that maybe we can, because there's, thousands of vessels, lymphatic vessels leading under the surface of the skin in the superficial pathways, that maybe we can reroute the fluid that way. There is also a deeper pathway, which you can, which again is closer to, the abdomen and whatnot. But to get into talking about the actual true lymphatic organs and systems, we have to get into talking about the spleen and liver and all of that. Then that might be a conversation for another day. It gets, we talk about immunity in the lymphatic system and how it plays a role in that. So if we know that the lymphatic system is directly involved with immunity, and you have a horse or a dog or whatever is fighting an infection, then we know that that's working over time. And which is also why it's so important not to do lymphatic work while the animal is on medication, because we don't want to encourage that filtration rate faster than the medicine's supposed to be in there. Does that make sense? So yeah. So if we want to make sure that if it's an antibiotic, for example, that we want to make sure that we don't push that fluid through the system faster than it's supposed to, because it needs to work in there a specific time.
Okay. So do you want to talk us through some additional contraindications or cautions that we need to have when we are working with lymphatic issues?
Yeah, for sure. I think that's huge. And I think that's something that everybody should really pay attention to, is contraindications. And I don't, not just for lymphedema cases, but for, body work in general. And a lot of therapists, I just posted this on not too long ago, a lot of therapists are concerned that they don't want to say no to their client. And I'm a big advocate for this, and I get messages all the time, saying, "Hey, Christa, I'd like to see this horse. This horse has a swollen leg or whatever." And my first question almost always is, "Has the vet been out?" Because they are truly the safety gatekeepers. They're going to make sure that it's safe for the horse to have treatment and safe for you to treat. I've worked with, and I'm super lucky. I'm really, really blessed to have the relationship I do with the veterinarians in Eastern Canada. They've supported me my entire career. And so, I always ask them, is it safe for this horse to have treatment? And the majority of the time we talk through it. But some of the major red flags, like when in doubt, just refer back out. If you're unsure, if you're getting pressure from your client, just say, these are the reasons why I think we need to call the vet back in. For example, an email the other day about somebody that had pectoral swelling. And could we absolutely tape it? Could we do manual lymphatic drainage on it? Sure. But the key thing was that they said there was a scab on it. Now, it might be a 1 in a million shot, but tissue is self-sealing. So if you have something that projectiles into the tissue very quickly, it will self-seal, and maybe there's a piece of fence in there, maybe there's a shard of glass or whatever, but we want to make sure that whatever that swelling is, that either we have an ultrasound or at least look by the vet to make sure it's safe. So one of the big contraindications is, how did it happen? Was it, is it very, very hot? Anything that is hot, you never, ever want to do manual lymphatic drainage or tape right away, because we want to make sure that that's not an infection brewing. Cellulitis is life-threatening, and it happens very, very fast, and you really need the vet there with some strong antibiotics. So something for like a local contraindication would be that. Another local contraindication where you may not want to work directly on the area is if it's too painful, right? If it's, say for example, if you've seen your horse get kicked, you're pretty sure there's nothing, there's no ribs broken or anything, but it's too painful. That is a local contraindication, but it doesn't mean that you can't work elsewhere, right? The biggest contraindications come when you see, like, if it's hot, if it's swollen very fast, if the horse has a fever, that's an absolute 100% contraindication. And one of the other ones that people don't really think about is environment. If you cannot control where the horse lives, what conditions it's in, it may be a contraindication to treat, right? Because first off, you want to make sure that what you're doing is going to help. If you can't control the environment, if it's not safe for them, then maybe you don't want to be there either.
Okay, fantastic. Thank you. For those that are joining us live, it's so good to have you. Welcome. Please feel free to ask any questions that you have. Join the conversation. We're really here to chat with you, so welcome. Okay, so what are some of your favorite techniques or tools to use to address blockages in the lymphatic system?
One of the things that a lot of people can do on their own is like cold hosing. Right, you wouldn't think about that, but what it does is actually helps compress those vessels. And one of the things that I really like is that if you take a wet towel and you put it in the freezer, but you don't completely let it get, like a block of ice, then you can take it out. And if it is a local, say for a fetlock, you can wrap that around. Especially like this time of year, we're not cold hosing out at my barn. But that's something that we can do. And what that does is creates a constriction of the vessels. One of the things, obviously, I love kinesiology taping, right? So anytime that you have somebody that was a little congested, maybe you can't tape over that area specifically, but there's no, if it's wrapped or bandaged or whatever, maybe you can do over top of the kidneys. Maybe you can do where the main lymphatic vessels, the aggregate lays where the shoulder meets the neck. There's all kinds of things that you can do. One of my favorites is, it's just a very, very gentle, slow movement technique. And that's the way I don't know if you guys know this, but the lymphatic system has two rhythms. And one is very, very, did you guys know that? Did you know that?
No,
Anybody know
I
that?
didn't know that.
See, 101 useless facts. So the lymphatic system has two rhythms. One is very, very slow. And so oftentimes when you're doing massage, slow your techniques down. But the lymphatic rhythm is a 1, 2, 3 technique. So that's even slower than massage. So almost always when you're learning lymphatic drainage, that's the rhythm that you're going to feel. So 1, 2. Everybody sleeping yet? 3. But then there's a second rhythm that's very, very fast. And when you can access that, that's when you're going to move a lot of fluid. And it's a 1, 2, 3, 4, 1, 2, 3, 4. But you have to learn all that stuff. I'll teach you guys later. So when you're doing even just massaging or grooming, keep it slow. The majority of those vessels that we talked about earlier that connect to the lymph nodes are almost all superficial. So here's your key points, right? The lymphatic vessels are under the skin. The lymphatic nodes in the horse, most of them are deep in the abdomen. So if you do that slow massage, you're going to be activating and encouraging lymphatic flow in the superficial vessels. Does that make sense?
Yes.
Yeah. So, don't think that you have to, and I don't do the squeeze technique, but I find that if you clear the area above the site or around the site, you'll be 10 times more successful than trying to actually attack and go at and work on the edema right away. Because you have to give that swelling somewhere to drain into, right? I always say, this is another one of my bad analogies, but I always say the lymphatic system is like a tube of toothpaste, okay? Here's my pen. So when you have a tube of toothpaste and the cap is on, the cap is on, you can squeeze all you want, but you're never going to get toothpaste out of that end. And so what you have to do is almost like take the cap off the toothpaste tube. And in doing that, in body work, means that you actually work all around the site first. And then it gives that fluid somewhere to drain into. I'm going to come up with a pen analogy next, watch. So don't think that you have to work directly on the site. Sometimes it's too painful for the horse. Work around the site, whether it's your body work or your taping. That's a really, really good thing that you can start with.
Okay, we have a great question here from Jessie. She asks, what is the stretch percentage for taping edema or no stretch? And maybe you could give us a little bit more information than that as well in, what directions are we looking at taping in? Talk a little bit about your histoband lymph as well and how that works and why it works. And let's go a little bit deeper into taping.
I can do that. Just give me 1 second. I'll find you some.
Yay! So I think it was last year. Did you launch Histoband Lymph last year? Yeah. So we're celebrating one year of Histoband Lymph.
I don't know if it's 1 year or 2. I don't know. It's a whole crazy. So, okay. So being a lymphatic drainage practitioner and one of the first people, I was the first person in Canada trained to tape. But how we were taught years ago was that you had to cut your tape and you did all these fantails. Well, at the time I was treating 150 horses a month and the majority of them were lymphatic issues. I found that I didn't have time to cut all of those little fantails. And then when you have the cases that I have, they're very sore, they're very painful, they've been picked at, they've been bandaged, they've been jabbed, they've been, they're tired and they're sore and they're just over it. So for me to have to sit there and wind all these fantails, I mean, they work, but there had to have been something better and more simple. So this is Histoband Lymph. And so basically what it is, it's a cotton tape with certain elastic fibers in it. And so there is this pattern out there already on the market, but I didn't have the adhesive I needed or the elasticity I needed. And so this is how you break your tape, folks, in case you didn't know. So you can see how shiny that is. That's specifically Histoband. That's my adhesive. So this adhesive and satin are the same. Cotton has a different adhesive, and there's a whole bunch of reasons why I did that. And we can talk about that another time too, I guess. But anyway, so with this tape, what it does, it mimics the lymphatic channels. And if you actually use this on humans, you'll see where the swelling pops through these holes, but these create channels. And lymphatic vessels have valves. So it's a one-way system. It can go up the valve via one pathway, but it never pulls back down. It'll go into the tissue. So these create channels and mimic the valves of the lymphatic system. And so it is quite stretchy compared to my satin tape. Do we want to stretch it? No, that's not why I made it this stretchy. I made it this stretchy because it has to accommodate for the fluid volume change. So if you have a leg that's, where's my camera? This swollen, you have to have enough elasticity in the tape to accommodate for that. Then you put your tape on, right? But your leg is still swollen this much. All the fluid evacuates through, and then the limb itself will go down in size. Does that make sense? So then the tape has to recoil. It has to have a strong enough elasticity to recoil. And sometimes if it drains really fast, the tape will pop off, literally like pop right off the limb. And that's a good thing. That means that it, has worked. But so in terms of stretching, very, very little. These tapes are developed so that you don't have to work that hard. I never do any surface prep except for brush off with a brush and wipe with a towel. Again, you kind of have to think about why I made these. It's because I was super busy and I needed something to stick to my woolly Canadian ponies. They're not show ready, especially this time of year. So I needed the really, really strong adhesive. And then for the lymph tape, I needed a certain level of elasticity, right? And that again is not for us to stretch. It's for so that the way the swelling works, say for this is a fetlock, you can actually do measurements throughout the day. And so if the swelling is mostly here, then what happens is that you can actually track it and you can write this in your charts as to how much, like 1 hour later, the majority of the swelling won't be here in the fetlock, it'll be higher up and then higher up. And that's how you know it's evacuating up and out of the limb. It's like fascinating. I love it. So that's, yeah. So one of the things you can do, look, I knew I kept this guy here for a reason. You guys are getting the full meal deal today. So
I love it. Christa, do you do a study where you look at that flow that you just described? I've never seen it, thicker, and then I've never seen that. You've got to do a study on that, please, so the rest of us can also know. Yeah.
So I need someone to come work at Hesta Band. That would be great. So I can develop all these courses I have in here. But yeah, no, absolutely. So let's go back and let's talk about that for a second. Can y'all see my little this guy's ancient. Like seriously, look at him. So say for example, you have edema here, right? And when you do your lymphatic drainage or your taping, before you start, you take specific measurements from one landmark to another, and you record that on your chart. So you make sure that it's straight, and then you say, okay, for 3 inches down, you measure around. Then you go 3 inches from that landmark and around 3 inches. It takes a long, long time. Like I don't do it much anymore in my practice because it does take a long time. And then again, 3 more inches from a specific landmark, and then you measure the circumference. And so then you're going to apply your tape. Here's my helpful hint. I'll show you. You must always, always, always tape proximal to distal, no matter where you tape. Why? Why do we tape proximal to distal?
Because it's pulling it from the bottom up. Yeah.
Right.
So if pulling it towards the point you start at. Yeah.
Yeah, exactly. So if the swelling is here, you need to clear this whole area to give this excess fluid somewhere to drain into. And then it gets recirculated through the body, right? So it either goes recirculated, repumped through the heart, or it gets excreted through the kidneys. So always, 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 you're going to tape proximal to distal, no matter what. And it might only be, this is your proximal and this is your distal, right? So that's one helpful hint for you guys. The second is, say, for example, if you don't really know what's going on, you want to kind of help. Maybe it's not even really that serious. Maybe your horse experienced tying up last week. Maybe they're just sore from showing. One of the things that a lot of the main aggregates of lymph nodes lie right where that scapula is. And so what you can do, and oftentimes I will do this before I start massaging, is that you're going to place it here. Look, what a good pony. And so that opens up that whole aggregate of lymph nodes. And then you can do your body work, and then you come back and you can either leave that on or tape, or, do another taping and then leave them for the day. But this will open up a lot of the lymphatic channels just by doing something simple like that. So
okay, I love that.
Yeah.
I should try that. I should try that. Sounds good.
Yeah.
Okay, what are some of the? Do you want to continue? Did I just interrupt you?
No, I'm good.
Okay. So what are some of the other things that that we might do? As you mentioned, like compression is actually quite a popular thing. Is that and that's not something that you do? Do you want to go into that a little bit more? Why not?
Sure.
Why do people use compression? What would how would you make that decision clinically?
So yeah, it's historically, I think that a lot of people will do compression bandages. Now, when you think about a compression bandage, it's really a short-term solution to a longer-term problem. What you want to do is and there are definite times where it's warranted. You're like, oh my gosh, the vet is there with you, and you're like, we've got to get rid of this fluid really soon because the tissue itself is being compromised. Obviously, if there is so much swelling, fresh circulation, nutrients, oxygen can't get back down into that leg, so therefore it can't heal. But what does it do? It compresses the vessels. And it's going to squeeze all that out, and it's going to kind of escape, the excess edema is going to escape out into the tissue itself. You take the bandages off, and what happens? It doesn't really reroute the fluid, right? There's always going to be that case where it was like, oh, thank goodness that's, we're done with the issue. It's not. But for the grand scheme of things, compression really isn't going to help long term. What you really need to help the body do is find other pathways to reroute it. The way I always think of it is that the body sends fluid down a pathway via one path, down the body via one pathway, and then up and out, say for example, of a limb via another pathway. Something happens, surgery, injury, illness, whatever happens, that one of those pathways are blocked. So the fluid can get down the leg via one pathway, and the body still thinks, oh, no, that door's open. That door's open. I can definitely send fluid back there, but it can't. And it doesn't shut that system off. So it keeps sending more and more fluid down the leg. And that's where you get that big lymphedema issue. So we have to teach the body that, you know what, those vessels are compromised. It's not working, but let's see if we can try to reroute the fluid to another pathway. Maybe you can't send fluid down that path and open that door, but I'll show you a window, and the body's like, oh, great, perfect, right? But for whatever reason, it doesn't get that feedback loop to say that, okay, I have to go out another pathway. It doesn't. I don't know why. It just doesn't work that way. So one of the things I'll tell you though, one of the things that you can do to really, really help is do fascial tapings above 100%. We just said two important things. Lymphatic fluid cannot pass through scar tissue or fascial restrictions or tight fascia. The other thing we said was that the majority of the lymphatic vessels lay underneath the skin. So what's one of the best things you can do? Right? So this is for those of you guys that don't know, and I don't mean this to be a has-to-band seminar, but so this is has-to-band satin, which is totally different. Cotton is really fun. Cotton is for muscle applications. Cotton was my first baby. Satin, again, we're going to show you that has that same kind of, see that shiny adhesive? So it has the same adhesive as this. It does not have stretch at all. Like it's so rigid, but what it's perfect for, I originally developed this for foals, actually, to mimic kind of their instabilities with ligaments. We'll talk about that another day, next month. I don't know. So with fascial tapings, we know that we do, whoops, where are we? We do a stretch and then a no stretch, right? Stretch and then no stretch. And that helps rearrange the fascial fibers. And at the very minimum, any sort of tape that you put on will create a lift, which also directly affects the fascia. So if you have, now I've just given you a whole bunch of tools. You've got your 1, 2, 3 body work, right? You've got a lymphatic tape, but maybe before you do your lymphatic tape, you do a fascial stretch release on the site way above and give that fluid an opportunity to disperse somewhere else.
Yeah, I love that. So with that fascial tape, I actually forgot about that application. Thank you. Do you usually put that in a straight line, or do you use like waves in your tape to create that stretched, shortened section within the tape?
So yeah, when you think about lymphatic vessels, they are not straight at all. They're kind of like rivers. They're all over the place. They have a bunch of tributaries, little collector vessels. So for myself, I'm a very linear therapist. It's hard for me, and I have to consciously not do straight lines. But I think any way that you can do, like the wave is perfect, in that you can, kind of access the most lymphatic vessels or the most fascial planes that you can. So you can do stretch release straight down, but you can also do a wave.
Okay,
I think the most important thing with the fascial taping is that you really need to have a defined area of stretch, then no stretch, stretch, no stretch. I think that's what makes it most successful. So already now you have a couple of things that you can do to help with, your lymphedema clients.
Okay, fantastic. Another question. So from Michelle, thank you, Michelle. What do you think of cold saltwater spa and or cryogenics for this problem?
Michelle, do you mean like an actual like lymphedema problem?
I think yes. Let's assume that she's talking about a lymphedema problem, and then she's wanting to use cold saltwater spa as a treatment or cryogenic. I think there are lots of different cryogenic like products and things at the moment. So let's focus on the saltwater spa and then maybe break it down.
Sure. So I think the cold water spa is invaluable. Anything that you can do to evacuate fluid out of that area. Now, with the cryogenic, there's a whole bunch of other techniques that you can do. The one concern that I have, and I just don't have enough experience, I've worked with it in Florida. The one thing I would be more concerned about if there's damage to the vessels, which we don't want, certainly we would want to make sure that there's always a reason for doing an application, whether it's cold water or whether it's cryotherapy. I know cryotherapy has worked amazing for certain local edema. Like if it's a localized edema due to a suspensory tear, I know that that's very successful. I think lymphedema cases are completely different. I would really want to work side by side with a veterinarian that had experience. Just because I don't know the physiological changes with the cryotherapy. It is hugely successful for local sites, but lymphedema is totally different. Lymphedema, the whole limb is compromised. So I would definitely want to do, work with the vet on that.
Okay, fantastic. Thank you. Christa, how can we create more awareness around these issues? And as therapists, how can we help our clients maybe in a preventative way to get ahead of problems in the lymph?
Oh, yeah. and this, I think education is massive. Like what you guys do is brilliant. And the fact that people can come back and rewatch things if they miss something. And for me, my dilemma is I get so excited and I talk really fast, and then the next thing you know, it's an hour later and we're done. So I think education is key to read up. Really start doing some research. There's some great stuff coming out. My second level instructor, Dr. Bruno Chickley, actually, surmised many, many years ago that there was a lymphatic connection to the brain. Well, he knew that, but it was only proven just a couple of years ago. Now we're just finding out that they found the lymphatics, which of the GI system, which kind of goes back into questioning about leaky gut syndrome in horses for me. Anyway, so anything you can read, anything you can learn, anything you can share. In terms of prevention, here's the thing. If you can ask your clients to control the environment that the horses are in, to make sure that when you bring them in at night, if they come in at night, or when you bring them in, to be groomed or ridden, make sure that their lower legs are dry. That's the biggest thing. Sometimes it can be the biggest problems that stems, biggest problem that stems from something so small as they have scratches or mud fever, that they did get a little nick when they were turned out and nobody noticed. But to really always keep, the lower leg dry and clean as possible. I mean, we're going to come into our mud season soon, and that's always a challenge. But every day, just take 5 minutes, brush off the legs, towel dry them, have an actual physical inspection. Run your hands down, make sure you go all into the crevices of the bulb of the hoof, and it's little simple things like that. And if you see, just don't wait. You don't want to be bugging your veterinarian all the time, but if you're kind of like, oh, that was a little swollen. Oh, it's a little more swollen today. And then 3 days later, you have to call the vet because you have a massive cellulitis problem now. Prevention is definitely key, for sure. And making sure that your horse is really hydrated. You don't want them to be, dehydrated at all because, as we know, the lymphatic system's made mostly of water.
Okay. Those are lovely. Thank you so much, Christa. To those that are watching, thank you so much for joining us today. If you want to learn more from Christa, where can they come to learn more from you?
You can find me on Facebook. There's 2 pages. I have my personal page, Christa Veinotte, and then there's my professional page called Christa Veinotte, International Equine Massage Therapist, because I set that page up like way back in, I don't know, years ago, and now I'm afraid to change the name. But at the time I was traveling a lot and treating a lot of horses internationally. So that's where that came from. But you can find me on there. Hesteban.com is the tape. You can always send me a message, info@hesteban.com. And and you can find me there.
So I want to add 2 things. Firstly, when we did our global industry report last year, Christa, did we tell you this? But Hesteban was in the top 10 products that veterinary havers voted for in that industry report. So that's insane, okay? Because Hesteban is still a new product on the market, and you were in the top 10 companies voted for by 650 veterinary havers. How have we not told you that?
I don't know. Honestly, I don't know. No, I never knew that.
I'm going to send you the report. I'm so sorry.
It's okay. Oh my God.
I'm going to send that to you.
I'm so sorry. Wow. Good coffee this morning, folks. I just want to
But that
can't believe you just sprung
that
on me.
I just sprung that on you. I'm sorry. That just goes to show how much veterinary havers that are using your product love it, because the question was something along the lines of, what is your favorite company or product to work with? And that was me.
Well done. Thank you, everybody. Honestly, it was because of wow, nothing ever nothing shocks me, people. This just kind of blew my mind. Thank you for that. Thank you, all of you guys, for that. I developed Hestband it didn't have a name then, but I developed my tapes because I needed them for my clients, right? That's what happened. And but then the pandemic hit and there was a shortage of tape, and people started asking me, hey, what brand do you use? And I'm like, it's no brand, it's mine. I made it for my clients. And it was only because of you guys. All of you guys were like, I want to try it. I got to have this. And then I sent out a bunch of tape tester packages. I think it went to like 70 packages in 2.5 weeks to 10 different countries.
Wow.
And it was the feedback that I got from you guys that this was born. Hesteband, in case you don't know, means horse tape in Icelandic. And yeah, I named it after the Icelandic pony because they're very resilient and they're strong and they're determined and they're very strong. So that's how that came about. Their support has been phenomenal, like just absolutely mind-blowing. And so this year the plan is that I'm going to try to get myself out of this office and into your world a little tiny bit, a little bit more. We're doing some more courses. I'm going to go to some trade shows and things like that so I can actually meet the people that, I always say this, you guys really have been with me from before the start of the company. And I thank you so much for that. And I'm just mind blown. Hesteband has now been sent to 32 countries, from a little place in Nova Scotia, Canada. And I just love you guys. And I thank you so much for all your support and enthusiasm. I don't know what to say. Thank you.
Are you coming to the IAVRPT conference in Cape Town in November?
No, I don't think this year. The biggest challenge I have with that, I want to come, and it was on the plans to come, is that I need to have a distributor set up there first before I can come.
That's going to be arranged. I can put you in touch with some people.
Yeah. That's the other thing about this year, is that there is a bigger, distributorship. People just want it all over the place, and so that's going to be the goal also, is to make it more accessible for you guys to get it around the globe. But yeah, it's just crazy. I can't say it's overwhelming, but it's just, I could have never predicted that this could have happened, and you guys have been with me from really early on too. So thank you for that. I appreciate your support.
For sure. So the second thing I wanted to tell everyone who's listening is that Christa has a recording in the Online Pet Health Equine membership, where she goes through the lymphatic system, shares some techniques. It's really, really good. So if you're an Online Pet Health Equine member, you can access that in your library. You're just going to search for Christa and it'll come up. Okay. So guys, we will come back and answer any questions afterwards as well. If you're watching as a recording, please feel free to post those questions, and we are here. Christa, thank you for your time today. Everyone that joined us live, thank you so much, guys. Have an amazing day.
Thanks, guys. Thank you.
Bye.